I think that there's a need for a lot of education in acute myeloid leukemia, and this has to be approached from many different avenues because different users have different preferences. So some people like to go to lectures, some people like to come to large meetings like EHA and ASH. Some people, especially in US, we see that almost 60 to 70% of acute myeloid leukemia and acute lymphoid leukemia is treated by community oncologists. And the bread and butter primary focus for those oncologists are the big cancers, lung cancer, colon cancer, breast cancer. So although they treat acute myeloid leukemia, acute lymphoid leukemia, this makes up less than 3 to 4% of their practice. And so they often don't have the time or the energy to focus education in that area. And I think this is where VJHemOnc is going to be a very good resource, where you can provide them access to experts in the field who are giving very brief talks, because also in today's world people don't have the time to sit through 1 hour lectures, but at least if they go listen to 5 minutes on a Saturday, what are the new updates in AML, what are the new FLT3 inhibitors, what is new with venetoclax, then we're hoping that we will penetrate more and more people. Because the concern in the United States now is that we're going to have a lot of these drugs on the market, but we may not be using them in 30–40% of those patients because people will not be aware. There may be a 1 or 2 year learning curve. And the second concern is they may not be used appropriately, and we may see undue toxicity or even fatalities, and then people will say, oh, this drug is dangerous, and it may be because they didn't use it the right way. So I think, with VJHemOnc and other educational endeavors, these are very critical for the next 3–4 years to educate the community physicians, to educate some of the academic centers as to what are the developments, but also how to use them appropriately. And also a third thing would be to refer patients to clinical trials. So if you have a patient, you've done the standard therapy, instead of treating that patient with random combinations and not getting the data and not knowing if it was safe or unsafe, that would be an ideal patient to refer to your local academic center that may be running a trial with novel agents or immune novel agents or other things. And then at least the patient will be treated, hopefully he will benefit, and the data will be collected. So a year from now, we will all know whether this worked, and if it worked, what is the right way to do it, and if it doesn't work, then we don't continue to do it. So I think it's a very valuable, important resource.